Abduction machine is very important for general hip health and knee stability. The goal with this one here is to fix yourself into position and keep the chest tall. You want to think about making your thighs long, so the thigh bone long, and rotating your knee outwards. You need to inhale as you're going into the movement, exhale gently as you're going back into it. Again, you want to stop, pause at both the concentric movements where you stop in this position and stop at the eccentric so you get a full clean contraction through the outside of the glutes at the side of the hip. So you need to pause, brace with the abs hard, make sure you're inhaling as you go out of the movement, pushing the outside of the thigh firmly into the pad, pausing and getting a good squeeze of the medial glute, inhaling back to the initial position. A variation you can use for the abduction machine is using a little pad or foam seat if you have them available. What this does is it changes the position of the thigh in regards to the hip. So if you were sat down on the seat, you'd be more in a hip flex position. Whereas when you have a pad, you're in a more hip extended position. And in this position, like so, you're in a very, very strong position to use the medial glutes. Therefore, they're going to be able to work harder and you'll be able to lift more weight in this situation. Again, you want to inhale as you're driving out and exhale on the way back in. Again, this variation may be important for people who struggle to feel the medial glutes whilst in the fully seated position, and therefore adding the blocks may assist them in really getting into the area rather than it going into other muscles, which is unfavourable. With the adductor machine, the biggest thing is going to be your initial range of motion. The adductors can become very tight when there is poor hip stability. Therefore, where you select the distance between the pads at the beginning of the machine is very, very important. You want to pick with your active range where you can get a full stretch but also get a clean contraction without causing any damage or strain to the groin. What you want to do is inhale as you're going out of the movement, so knees out to the side, and exhale, bracing your core, breathing out as you go into the contraction like so. You need to pause and make sure you get a firm contraction with the adductors. Pause into that position before going into eccentric. Also tuck your hips posteriorly, so that means tuck them underneath toward you, making your lower back long, squeezing the abs, driving your sternum down in towards the pelvis. So you're inhaling as you go back, and then a strong exhale, squeezing the knees together as you're going into the concentric.